Hi, my name's Adam Semple, and this is Fighting Fire with Fire, the effects of chemotherapy on the body. This video was produced by Marissa Siegner, Abby Spence, Megan Stover, Megan Sprague, and myself, Adam Semple. So what is chemotherapy? Chemotherapy, sometimes called chemo, is a drug treatment for many different types of cancer. They use drugs that kill dividing cancer cells, further preventing them from growing further. Many chemo drugs have severe adverse effects, which will be discussed later in this video. Either single or a combination of drugs will work together to interfere with the cell's ability to divide and reproduce. Chemotherapy can be given in a multiple of ways, some examples being by mouth, as tablets, liquid, or capsules, even intravenously as an injection or infusion, even topically on the skin. What are some signs and symptoms of cancer? Well, cancer can be present in the body in different ways. However, here are some symptoms that can present and be indicative of cancer. Changes in a mole's appearance, unexplained lumping or swelling, unexplained bleeding, unexplained weight loss, unexplained persistent pain, persistent cough, change in either bowel or bladder habits, and even unexplained tiredness and unexplained night sweats. How does chemotherapy target cells? Chemotherapy works by stopping cell replication. The chemo drug of choice will have several different types of action, but they mostly all target the nucleus of the cell. By targeting certain enzymes, they restrict cell replication, thereby canceling cell growth. How chemo affects the healthy cells. Because chemotherapy is a cytotoxic substance, the healthy cells of the body are also affected. One common problem that occurs after chemotherapy is the effect it has on the body's ability to create blood product. This results in something called myeloid malignancies, which are tumors that result in the bone. What are the short-term side effects of chemotherapy? Chemotherapy has many short-term side effects. Each person will show different effects, but the main side effect people have reported are hair loss. Hair loss usually occurs on the person's head, but can occur all over the body. Nausea and vomiting, shortness of breath due to fatigue, nerve damage. The person may feel burning, shooting pain, or numbness and tingling. A person may have a muscle spasm, mouth and throat sores due to the certain medications. They may also develop insomnia and appetite changes, as well as changes in memory and concentration. Some people refer to this as chemo brain. What about the long-term side effects? There are many long-term side effects of chemotherapy, and they can affect all body systems. Some side effects affecting the heart include congestive heart failure, coronary artery disease, hypertension, and arrhythmias. The chance of getting these side effects are increased with age and with higher doses of chemotherapy. Chemotherapy can change how the lungs work, thicken the lining of the lungs, and cause inflammation, which would cause the patient to have difficulty breathing. This treatment can also cause early menopause, hormone imbalances, and infertility. Chemotherapy can eventually lead to osteoporosis and joint pain as well. At high doses, it can cause hearing loss as well. The treatment can lead to cognitive problems and something known as chemo brain. Chemotherapy can affect tooth enamel, change the way the teeth develop, and can change how a person digests their food. Treatments of cancer can also have major effects to their mental health and cause anything from relief, sense of gratitude, fear, anger, guilt, depression, anxiety, even feelings of being alone. Chemotherapy, in addition to all of these side effects, will cause fatigue that can last months to years after finishing the treatment. The nadir of the immune system. When on chemotherapy, the body's immune system is deteriorated. The body's immune system will hit its lowest possible point, known as nadir. This usually occurs about 10 days after treatment, but it varies on the type of chemotherapy drug being used. The reason nadir occurs is because there's a gap between the death of cells from chemo treatment and the time it will take for the body to produce new blood cells. Stem cells are immature cells that blood cells develop from. Stem cells do not reproduce fast, therefore they have a lesser likelihood of being affected by chemo, as chemo targets rapidly growing cells. When cells are maturing, there are phases within the cycle where the cells will divide faster, and this is when they are most sensitive to chemotherapy. More mature blood cells will continue to become fully mature for several days after chemo is given. However, when these mature cells live out their lifespan and die, the circulating supply is depleted and the blood count falls. The blood counts return to normal within 3 to 4 weeks after the body's feedback system has recognized and communicated to the stem cells of the bone marrow to increase production and start making new cells. It's important to know this because if chemo is given at the time that the stem cells and the bone marrow are increasing production, it will cause permanent bone marrow damage. Therefore, the timing of chemo cycles takes this into account, and the next dose of chemo is given only after a patient's blood count has reached a safe level. The greatest concern at this time is that the body's first line of defense is low, thus leaving the patient at high risk for infection and bleeding. Chemotherapy drugs can be divided into many different subcategories based on their composition and how they affect the cell overall. The list I'm about to go through is not an inclusive list. It is some of the more relevant ones that are being used for treatment today. First, there are alkylating agents. Some examples would be altretamine, bendamustine, and busulfan. These drugs will work by damaging the nucleus DNA to prevent the cell from reproducing. They work on all phases of the cell cycle and can be used to treat a magnitude of cancers, examples being breast, lymphoma, and multiple myeloma. They can also affect cells of the bone marrow. It is rare, but some cases can lead to leukemia. Another type of drug is nitrosoureas. Some examples are carmustine and lomustine. These drugs are able to travel to the brain and can cross the blood-brain barrier. In cases where the brain tumor is present, these drugs are very ideal. The next type of drug is antimetabolites. Some examples are azacitidine and 5-fluorouracil. These drugs work by interfering with DNA and RNA by acting as a substitute for the normal building blocks. This leads to the cell not being able to replicate, since DNA cannot make copies of itself. These are used most commonly to treat leukemias, breast cancer, ovary and intestinal tract cancer. The next type of drug is anti-tumor antibiotics, also known as anthracyclines. Some examples of these drugs are daunorubicin and epirubicin. These drugs work by changing the DNA inside the cancer cells to keep them from growing and multiplying. One major concern with these drugs is heart damage. They can cause permanent heart damage if given in high doses. Next, we move into mitotic inhibitors. Some examples are cabazitaxel, docetaxel, and vinblastine. These drugs work by stopping the cells from dividing to form new cells. They can damage cells in all phases by keeping enzymes from making proteins required for cell production. Some other drugs to be considered are topoisomerase inhibitors, also called plant alkaloids, and corticosteroids. As seen above, most of the drugs interfere with RNA and DNA in some way, and others may have certain effects such as nitrosoureas, being able to cross the blood-brain barrier. The survivability of cancer varies on what kind of cancer you have and how early it's caught. With the exception of lung cancer, patients can expect an 85 to a 99% chance of successful treatment if the cancer is caught between stages 1 and 2. In closing, chemotherapy impacts people in both negative and positive ways, the negative being not having the same energy they used to before starting the chemo, and changes to leisure time and social life. Some people reported they struggled months after treatment, not only physically, but psychologically and emotionally. The positive impacts that people experienced were living longer due to the chemo shrinking the tumor and slowing the growth. Depending on one's outlook, chemotherapy can change their sense of life and how they look at themselves in a positive way. Chemotherapy is an aggressive treatment against an aggressive opponent, using radioactive and cytotoxic combinations to fight a disease that strives to drain the body of its resources. Healthcare professionals understand the need to fight fire with fire.